Let us pray. Almighty God, in your wisdom and goodness, have appointed the office of leaders and legislative assemblies for the welfare of society and the just government of the people. We beseech you to behold with abundant favor as your servants, whom you have been pleased to call to the performance of important trusts in this republic. Let your blessings descend upon us here assembled, and grant that we treat and consider all matters that shall come under deliberation in so just and faithful a manner as to promote your honor and glory, and to advance the peace, prosperity, and welfare of our country and of those whose interests you have committed to our church. Amen. Good afternoon, honorable members. Mr. Clerk, proceed.
Order number 1, administration of oath.
Proceed.
Order number 2, communication from the chair.
Proceed, please.
Order number 3, messages.
Proceed.
Order number 4, petitions.
Honorable members, under this order number, we do have a petition which has been received in the office of the Speaker, and I am going to give details on it. The petitioners are cleaners of Machakos Level 5 Hospital, working under a contracted company by the name of Diana King Investment. The petition was submitted to the County Assembly on the 2nd day of December 2021, pursuant to Article 37 of the Constitution of Kenya 2010, Section 15 of the County Governments Act 2012, and Standing Order number 194 of the County Assembly of Machakos Standing Orders. Honorable members, the petitioners have raised the following grievances. 1, that they have not received their salaries for up to 8 months as of the date of the petition. 2, that neither the Department of Health and Emergency Services nor the contractor seems concerned on the accrued debts even after the cleaners sought to know their fate. 3, that some of the hospital cleaners have been arrested whilst questioning on delayed salary payments. 4, that the cleaners are currently on strike because of the unpaid salary arrears. The prayers of petitioners, honorable members, the prayer to the Assembly is that the Assembly sees to it that the contractor pays the petitioners their due salaries. Standing Order number 200 provides that the Speaker may allow comments, observations, or clarifications in relation to a petition presented or reported, and such time shall not exceed 30 minutes. Further, Standing Order number 201 provides that every petition presented to the report pursuant to this part shall be committed to the relevant sectoral committee. So before I commit this petition to the relevant committee, I would like to, as I've noted there, open it up for honorable members to comment on this petition which I've received in regards to these cleaners from Machakos Level 5 Hospital. You may comment, those who wish to comment. Honorable Judas Ndawa.
Thank you, Mr. Speaker, sir. My name is Judas Ndawa. I'm CMA 2. Mr. Speaker, on the matter before the House, I want first of all to start by saying sorry to the aggrieved parties, or the party that has filed this petition. Mr. Speaker, it is evident that things are not working in our facilities, health facilities. And this is a problem which is cutting across the entire county. Mr. Speaker, it is not fair for somebody to be given a certain task to perform at an agreed consideration, and the other party, that is the appointing authority, fails to honor its obligation. Mr. Speaker, I want to agree with the petitioner or the petitioners that they need to be paid their dues. Because if you engage somebody and you don't pay him or her for 8 months, and that particular person has a family, that particular person may be staying in a landed house, how do you expect that particular person to manage his family? Because you'll move out of your house to go and work so that you can get something that will sustain you in your life. Mr. Speaker, there is laxity. And when we say there is laxity, we are not fighting anyone. In most cases, when we say there is laxity in a certain department, we are seen as if we are fighting. But this time around, we must say it clearly. There is laxity because when we pass the budget here, the Department of Health was given the lion's share. And Mr. Speaker, it is very shameful if our clients or our patients, the moment they get into the compound of the facility, they are required to go and maybe buy gloves somewhere so that they can be given services. And this is something that is happening in almost all the facilities, starting with Matu, where I come from. Mr. Speaker, it is very unfair. It is very unfair. We are also in the social media and we see how our clients, how our electorates are complaining about the poor services in our facility. Right now as we talk, the ambulances do not have fuel. The hospitals, no drugs. Honorable committee agreed with me. Last week, I had my own vehicle to transport a patient who was knocked down by a motorbike and sustained a very serious injury on the head. I had to transfer that particular person from Matu to Machakos. Then from the Machakos, after the X-ray was done, I was required to take the patient to Kenyatta National Hospital. That is the duty which is supposed to be done by the county and the Department of Health, which is now we are doing it for ourselves. Mr. Speaker, we request the government, that is the executive, that is the Department of Health, to address the issues of health in our facility. There was a time my hospital, that is Matu, was almost closing up. I had to write a letter to the governor because some of the services had already been withdrawn. The contracted clinical officers had already withdrawn. Those who supply food within the facility had already withdrawn their services. Those who give cleaning, those who clean the hospital, and also withdrawn. So, if the hospital can remain for 5 days without being cleaned, it means now that is not a good place for patients to visit because they can contract even more serious disease than the one which is bringing them to that facility. So, Mr. Speaker, I agree with the petitioner and request the county government of Machakos to ensure that those workers are paid. I believe there is that Diana King, we call it Diana what? Diana King company which is given that work to do. If the owner of that particular or the director of that particular company is also obliged to pay the workers, because the workers who are complaining now do not have any contract with the county. It is Diana King who has contract with the county. So we are requesting that particular director to ensure, because before you get any contract, you prove that you have the capacity to sustain that contract. So we are requesting Diana King to ensure that he pays the cleaners. And I'm also advising the patients, the cleaners, if you employ somebody and you don't pay, that is a criminal offense. Let them also report to the police so that that particular director is also arrested. And if he's not arrested, we need to confine him to what we call civil jail. We will confine him to civil jail and pay for his food to stay there so that whoever is a friend to him will come and pay and rescue him. Mr. Speaker, we should not allow this madness to continue while we watch. Lastly, Mr. Speaker, because I may not have an opportunity to speak again in this house before we go home, I would like to take this opportunity to wish the Machakos residents and Matu electorates a Merry Christmas and Happy New Year, and remind them, as we celebrate the Christmas, we also remember that January is coming, so we save something for the kids to go to school in January. Thank you very much, Mr. Speaker.
Thank you, Honorable Judas Dawa. Honorable Mweni.
Thank you, Mr. Speaker. I'm Bendeta Mweni Musyoka, nominated by Wiper. Mine is to say that in the general hospital, there's nothing which is going on there. When you go there, want to get a child, you are told to go and buy everything, even the Panadols and the drips which are given to the women to give birth very fast. I went there, and Mr. Speaker, what I was told to go and buy everything. Even the sweepers said they are not working because they are not paid. And the contract is being owned by our executive. Even when they are given money, the contractor, the money is taken before he or she received the money. So there's a cartel which is going on there. Even if there are some people who can record me, it's the executive which is having the money. They don't reach the contractors to be paid. So what is there, you check who are taking the money so that our people can be suffering. There are some people who are going there from Mheshimiwa Kibaoni, and they cannot give birth because they are not having the medicine to be helped to push the kids. So it's very unfair. Even if you can go there, you can cry. A woman is staying there for 3 weeks, having no medicine to be put to push the child. So, shame on the executive.
Thank you, Honorable Mweni. Honorable Patrick Ketuku, I would like you to relocate. There are COVID rules in place. Could you come and sit? There's an empty seat right in front here, because there has to be maintained the normal distances. Honorable Patrick Ketuku, please. Yeah, there's an empty, there's a vacant seat here. You can be able to sit. Thank you. We must maintain COVID rules, regulations at all times, honorable members. Honorable Kieti.
Thank you, Honorable Speaker. I'm Cosmas Kieti, representing Loaka and Kan Ward. Mr. Speaker, I think the petition that has been brought by the workers who are in Machakos level 5, I think they have a right to do so. And it is not just level 5 hospital. Even in level 4 hospital like Kathiani, the workers also went on strike because of non-payment. And if members can remember, just the other day we were discussing about the CHVs, whom we know that we allocated a budget for them to be paid, and up to now they have over 20 months without getting their pay, and it is still within the same department. And considering the circumstances which these employees go through when they are cleaning the hospitals, as Honorable Dawa said, chances of getting infections are very high. And when you look at even the attires which they use, in fact, they do not have the right attires in most cases. So they are exposed to a lot of danger when they are working, and then at the end of it all, their pay is not forthcoming. So, Honorable Speaker, this is a matter that we need to consider, and the committee that is in charge of the committee that will be in charge of that petition needs to move fast so that we may push these people to ensure that our workers, those workers are paid their dues. And it was very unfortunate. The workers went on strike today, and the following day, they hired casuals, which means they still owed money. And that is very unfair under any circumstance. You cannot fire somebody and then in the following morning, you have hired someone else. Meaning, you are just misusing the employees. So, Honorable Speaker, we need to move fast and assist our people. Thank you.
Thank you very much, Honorable Kisini.
Thank you, Mr. Speaker. My name is Honorable Robert Kisini, representing the people of the river. Mr. Speaker, it is a very sad affair that people can go without being paid salaries for 8 months. You can just see the situation is very bad. And then we can also see the situation of the hospitals when there are no cleaners. Mr. Speaker, it is very pathetic. It is very bad. I don't know if it is the executive which has failed to pay the contractor, or it is the contractor who has failed to pay the workers. Mr. Speaker, you can see the consequences of all this when the hospital is not cleaned. And bearing in mind the times we are now in, the time of the virus, the time of flu, and then we add up an unhealth hospital which is not cleaned. So, Mr. Speaker, I do request that we take the most immediate measures to rescue the situation. While we were at school, at a closing time, you used to say, I'll close with you. Let us close with this one. Thank you, Mr. Speaker.
Thank you, Honorable Alex Kamito.
Thank you very much, Honorable Speaker. I'm Alex Kamito, MCA Talawal, and leader of government business in this assembly. Honorable Speaker, this is a very noble petition. It's a very good statement in regard to petitioners who have not been paid for 8 months. At generally, level 5 hospital Machakos. Honorable Speaker, with a lot of honor, I'll take up this measure, this statement, this measure, in regard to finding out, one, Honorable Speaker, that if the contractor was paid. Two, in this statement, it is very clear that these are not government, they are not county employees, they are casual workers being paid by one individual contractor. So my main promise, Honorable Speaker, is the
Point of information, Honorable Mwani. Just Alex Kamito, let's hear the point of information.
Thank you, Mr. Speaker. The money comes from the government. Nobody is paid from his pocket. So the government has to give the contractor the money.
Okay, go ahead, Honorable Alex Kamito.
Thank you very much, Honorable Speaker. My honorable sister, Mweni, she's not getting my word. I'm not saying that the government or what I'm saying. I want to find out if the contractor was paid by the county government. I'm not denying. So there are two issues I said. One, these employees are casual who are being paid by a contractor, contracted by the county government. So as I said, as the leader of minority and as the eyes of the government in this assembly, I'm going to check whether the contractor was paid by the county government and define a very outrightly thing that these are not, I've said, these are not county workers. They are casual workers who are under a contractor. So that is exactly as I've said to our Honorable Speaker. I'm going to find out and bring a report to this House, Honorable Speaker, whether this contractor was paid. And if he was paid, I'll bring the same report that on this date he was paid. If he has not been paid, I'll bring the same report that he was not paid.
Thank you.
So on that regard, and as a humanitarian grounds, Honorable Speaker, it would be very bad if this contractor has not been paid by the county government. But if he has been paid, then this house will take actions same as if it is going to take the same action if the county was given money and it did not pay the contractor. So I'm going to take up that issue, Honorable Speaker, and I'll bring a report into this house any time that I'm told to bring. Thank you, Honorable Speaker.
Thank you. And finally, Honorable Betty.
Thank you, Mr. Speaker. I'm Honorable Betty Nzioki, representing the great people of Masi. Honorable Speaker, I stand here just to contribute on this issue about the petition that has been brought in the Assembly. Honorable Speaker, I can say it is unfortunate. And on a human background, it is ungodly if people can deliver services to our hospitals and they cannot be paid. Honorable Speaker, this is a cry that is going within our county, not even Machakos level 4. Honorable Speaker, when the petitioners, they wake up every morning coming to work, they clean up those hospitals. Some things that are being done, even some of the rooms that are being cleaned, even as a human being, you can be surprised. You go there, they don't have gloves. You go to the labor wards, nothing is happening, and they are cleaning up those bloods. And unfortunately, they are not paid. What are we doing as a county? And this is something that I want to say to the executive. Leave alone us, we can take care of ourselves, even as an honorable members. But when they wake up every morning, going to work, even to provide for their own families, at the end of the month, they are not getting anything. On humanitarian grounds, these people, they make our hospitals clean, even the toilets themselves. And sometimes you can go there and you find pathetic things there, but they normally do it because at the end of the day, they are giving service delivery to our people, but they are not being paid. Honorable Speaker, this is my humble request to the executive. If they've not paid the contractor, let them pay. And I can remember very well when we were passing this budget, this financial year budget, we gave a lot of money to the health department so that they can cater for our people. It is the same cry that our CHVs up to now, they are not paid. And we are just still here saying that we don't have money, we've given the budget, still that is under health. What are we doing as a county, not as an assembly? And Honorable Speaker, for me, I can say it is ungodly. And one thing I believe in, the Bible says, the measures that you normally give to a person, it will come back to you, even more than the way you gave it to your partner. It is unfortunate. And I want to support these petitioners. And it is good for the governor to come out and hear the cry of these families and the cry of these people. And other than anything else, let us have that humanitarian heart and that godly thing, because this is something that, I don't know, even we are not supposed to be here discussing issues of petitioners, petitioning of being unpaid, and to make the matters worse, they are cleaners of the hospital. It is unfortunate. So, Mr. Speaker, it is my humble request, as in our assembly, let us play our role. Let us do what is supposed to us to do. And then the rest, we leave it to the executive. But this is the high time, Mr. Speaker. We need to stand for our people. We need to give justice to our people. So, Honorable Speaker, let the committee do what it's supposed to do, and us in as assembly, and the executive as well. The way Honorable Kamitu has said, let him inquire, and we know where the problem is, because this is ungodly. Thank you, Mr. Speaker.
Thank you, Honorable Betty, for that submission. This petition is hereby committed to the Committee on Labor, ICT and Public Service. This committee has 60 calendar days to consider and table a report on the petition to this House, pursuant to Standing Order number 201, Sub Order 2. Honorable Alex Kamitu, you'll work with this committee. The information you are seeking, we present it before the committee, so the committee can be able now to include your findings in their report before they bring it before the House. One thing which I've observed personally from the comments made by the honorable members, Honorable Katie mentioned that as soon as these workers were stopped, Diana King Investment engaged cashiers and started paying them. So I do not believe it's an issue of money. You'll find out. But if he had money to pay the cashiers, then definitely he should have had money to pay these workers who have been demanding. If Diana King Investment has been consistently now maintaining cashier workers in the hospitals, whereas he has a debt outstanding outside there of people who worked. Because I would like to imagine that these are maybe the same people who were being deployed during the COVID time to clean areas like in the stadium and stuff like that. And if these are the same people who are working there and you are not being paid, and the kind of exposure you are giving yourself, you're even exposing your family. By going to clean in those areas, you have a family back home. You are risking contracting COVID and passing it over to your own family. And at the end of the day, you don't get your fair consideration of what you are doing. That, I think, is something which needs to be looked at quite deeply and investigated, and a detailed report brought before the House so that the necessary action can be taken. Thank you. Mr. Clerk, proceed.
Order number 5, papers.
Proceed.
Order number 6, notices of motion.
Proceed.
Order number 7, statements.
Honorable members, under this order number, we have 3 statements. The first one is to be moved by Honorable Moses Mita, MCF for Kangundo Central Ward, and the Majority Whip of the House. The second one is going to be moved by Honorable Justice Katumo, and the third one is going to be moved by Honorable Anthony Mulu, Vice Chairperson for Trade. We start with Honorable Moses Mita.
Thank you, Honorable Speaker. My name is Honorable Moses Mita, representing Kangundo Central Ward. Honorable Speaker, Chapter 6 of the Constitution of Kenya 2010 provides for the guiding principles of leadership and integrity. Further, Section 148.3 of the Public Finance Management Act 2012 provides that a county executive committee member for finance shall ensure that each county government entity has an accounting officer in accordance with Article 226 of the Constitution. Section 149(1)(a)(b) further states that an accounting officer is accountable to the county assembly for ensuring that the resources of the entity for which the officer is designated are used in a way that is lawful and authorized, effective, efficient, economical, and transparent. Honorable Speaker, pursuant to Standing Order 41(2)(c), I wish to seek the following statement. 1. How much funds the county hospitals have received from the National Hospital Insurance Fund, that is NHIF, for the last 3 years, and how the funds are utilized. I wish that the response should be accompanied by documentation. 2. This Honorable House enacted the Machakos County Health Service Act 2019, which provides for a framework of plowing back funds collected as user fee charges in health facilities. Why is it that implementation of this act has never been done before? Currently, funds collected from these facilities are banked in the County Revenue Fund account and never plowed back to benefit the same facility. 3. Provision of grants received at Machakos Level 5 Hospital for the last 3 years. Also, I request that the response should be accompanied by documentation. Thank you, Honorable Speaker.
Thank you, Honorable Moses Mita. As is customary again, I would like members to comment. If there's any member who wants to comment on this statement which is being sought, which in brief, the Honorable member is seeking to find out what happens to NHIF funds once they are redeposited back in or received from the NHIF into the County Revenue Fund. And also, he is also seeking to find out about the implementation of an act which was passed by this Honorable House, the Machakos County Health Services Act of 2019, which in brief, if you can remember, stated that funds collected in facilities as user fees should be plowed back to the same facility so the facility does not lack basic things like gloves. The aim of that act, if I remember well, was that if, for example, a facility is provided with a bundle of, to put it simply, they are given gloves, and these gloves are charged to the patient, and the money is collected, then there should be no one time when the facility should not have gloves, because when they collect the money, they should just go and buy other gloves to replace the ones which, because they have been paid for. I think that was the aim of that act. And then on the third item, he's talking about the conditional grants. Machakos Level 5 receives over 300 million shillings every year as a Level 5 support from the central bank or from the treasury, and they would like to know how is that money for Level 5 support utilized. Anybody who has a comment on this, or can I commit it to the committee? Honorable Kingori.
Thank you, Mr. Speaker. I want to thank the member for seeking for that statement because it's long overdue. I also want to add that we also need to know whether the CEC have already brought the regulations to operationalize that act, because it seems that when we do act here, regulations are not brought for implementation purposes. Thank you, Mr. Speaker.
Thank you, Honorable Kingori. Honorable Thomas Mutinda.
Thank you, Mr. Speaker. My name is Thomas Mutinda, representing Wamonyo Ward. I thank the speaker of the statement, Honorable Meta, for this good statement, and say that it's unfortunate that we are in this situation where such monies are banked in the revenue fund, because the moment you bank the revenue fund, then automatically they will be transmitted to the central bank, Nairobi. So it should be taken seriously that any act approved by this House should be implemented. If you have an act to that effect and other acts, not only that one, which is not being implemented, then I think this House has to move a notch higher and ensure that we implement these acts. Because if we don't implement them, then we can also term ourselves as also wasting public money if we are paid to make this and we don't implement. So let's move with speed and see that these people are helped. Mr. Speaker, it's not only in this facility. There are even the others down there. They borrow food, but they don't pay because the transmission of the funds is like the facility has no control. During borrowing, the facility is in the face of what the work, but when the invoices are brought, then they start chasing up such invoices. And it also turns down our image, because when we are here and some of these things are happening, then as you walk, you ask, what are you doing on this? What are you doing this? So, Mr. Speaker, I urge that we see to it that these things take place so that our people do not continue suffering. These Level 5 grants and others should be here to complement whatever funds we have here. and the system of accessing the funds should be easier. Because as it is today, gloves are not available, it's COVID time, and we are here. I think it's important that, Mr. Speaker, the staff are helped and the people of Machakos benefit from these funds. Thank you, Honorable Speaker.
Thank you very much. Honorable members, Honorable Down.
Thank you, Mr. Speaker, sir. Supporting the statement, I would request if we can also include in that statement the issue of disbursements of monies to the facilities, because when we passed the budget here, we allocated level 4's monies and also level 5. I remember very well Kangundo was given over 12 million, Matu was given over 12 million, Kadiyani and the other, Mala level 4. Mr. Speaker, from the facility, we are getting information that they only received money once. They only received money once. So I would request if we can also include in that statement that they can also share information on how they are dispersing monies to those facilities, because the facilities are suffering. And there is no need for the facility to lack equipment when we have funds. Thank you, Mr. Speaker, sir.
Thank you, Honorable Judas Ndao. So this statement, which is seeking the following: 1, NHI funds and how they are being utilized with supporting documentation. 2, the enactment of the Machakos County Health Services Act 2019, which was done, whether it is being implemented and why the user fees are not being plowed back into the facilities. 3, grants which are received, especially Machakos level 5 receives over 380 million shillings every year as level 5 support, how they are being utilized. And 4, what Honorable Judas Ndao has added, the amounts which are budgeted for in the various facilities, how are they being disbursed to the various facilities for utilization. I commit this statement the Committee on Health and Emergency Services, and it should revert back to this Honorable House, this being an health matter, within the next 30 days, so that we can be able to get to a logical conclusion on most of these issues. I personally do not understand how you are in charge of something as delicate as an hospital, and you are sitting in the head office in level 5 or wherever you are, and you have not dispersed funds for food or cleaning or anything to a facility like Matu. A month goes, another month goes, what do you expect them to be doing? Because these things are being utilized, they're handling patients, there are people who are admitted there, they are eating food. All these things which are being done, how do you expect them to be happening if you are not dispersing funds? And this reminds me that when we are in the process of reviewing the budget, it's actually the budget committee which returned back to them the budget they had brought, because they had not allocated operative expenses for all the facilities. Everything had been lumped in Machakos level 5 hospital, and all those level 4s and level 3s had 0 in them. We had to tell them to go and reallocate those expenses again accordingly in the various departments. So there is something which needs to be done in as far as the accounting of these funds and as far as handling of health matters is concerned. And the health committee needs to take charge of this statement and ensure they bring back the statement to this Honorable House. The next statement is by Honorable Justice Katumo. Honorable Justice Katumo.
Thank you, Honorable Speaker. This is a statement on the payment of dues to farmers of Machakos Cooperative Union. Honorable Speaker, according to a newspaper dated 4th October 2017, Machakos Cooperative Union was included in a debt relief to farmers for standing loans amounting to Kenya shillings 176,250,584 shillings from the Ministry of Industry, Trade and Cooperatives. Guided by the ruling made by Judge Pauline Nyamwea of 3rd February 2011, which directed the Ministry of Finance to avail the list of all farmers in Machakos District Cooperative Bank within 90 days, and the amount withheld from Machakos farmers. And aware that, Honorable Speaker, that between 1993 and 2011, the dispersed property worth 640,300,000 shillings. Honorable Speaker, pursuant to study order number 41, I wish to seek a statement on the following: that the Machakos Cooperative Union provide the Assembly with documentation or information on how the above stated amount was dispersed to the coal farmers in Machakos County. Thank you, Honorable Speaker.
Thank you, honorable members. I believe this issue was exhaustively discussed in the morning, and that's why it has been brought back as a statement. It is seeking to find out what the Machakos Cooperative Union did in reference to the amount of money, 176,255,084, which was given from the Ministry of Industry, Trade and Cooperatives for outstanding loans, as guided by the ruling by Judge Pauline Nyamwea of 3rd February 2011. And also, it is noted that the Cooperative Union had earlier on in the 90s disposed of property worthy over 640 million shillings, which monies were supposed to be used also in settling accounts for those, especially those farmers who had bank accounts with the defunct cooperative union and also who had outstanding dues from them. And therefore, this statement I committed to the Committee of Agriculture and Cooperatives so they can be able to investigate this issue thoroughly and bring back a report to this House within the next 60 days. Honorable Mita, I do believe this falls under your docket. Please go ahead and let's find out and see whether our farmers can be able to get their fair share of these monies, or what happened to the monies as after they were dispersed. Thank you, Honorable Mita. Honorable Anthony Molu.
Thank you, Honorable Speaker. It's a statement on extension of time. Aware that the Committee on Trade, Economic Planning and Industrialization is established pursuant to the Standing Order number 190 of the second schedule of Standing Order, which defines its mandate as follows: to deal with all matters related to the economic planning, trade development, and regulations, including the market's trade licenses, excluding regulation of professionals, fair trading practices, and statistics. Aware that the County Assembly received a petition of the Mavivia market by the Mumbuni location residents, which seeks the resumption of the wholesale market to Mavivia market, noting that the petition was committed to the Committee on Trade, Economic Planning and Industrialization on the 16th August 2021 for the investigation and eventual tabling before the House within 60 days, which lapsed on 25th October 2021. Further, aware that the committee is yet to undertake a site visit to the market to ascertain the availability of land for construction of habitat as claimed by the petitioners, and as well as visit the Machakos Marikiti market to observe the normal operations during market days. The committee also resolved to invite the municipality manager, municipality committee, and wholesalers committee to hear their views. Honorable Speaker, I wish to seek extension of time to enable the committee to complete the above tasks, to complete the above tasks. Thank you, Honorable Speaker.
Thank you, Honorable Molu. I think this is a straightforward item where they are seeking for extension of time. Mine is just to note that from 16th of August 2021, we are seeking for extension of time in December. And urge this committee and its members to take committee work seriously. Because an item was committed to a committee on the 16th of August, and we are now closing the year, and it has not yet been actioned. Then there is some failure on the part of the committee. I therefore direct that this committee looks at this item and it brings back a detailed report to this House. Whatever it needs to be done, let it be done, but I would request the House to get a report on the second week after we report back. What dates are those? Second week after we resume. So if it means working over the long holidays or early in January to do your site visits and stuff like that, you do it to ensure that we have a report on or before the 1st of February, right? Should be on or before the 1st of February because we are resuming on 25th. So let me say the week of the first week of February, we need to be able to get a report before this House on this specific item. I have seen the committee is here to take a site visit to the market to ascertain availability of land for construction of an abattoir. I think the most important thing for this committee to be going to ascertain, this comes from my area, and that's why I'm having information on it, is to go and ascertain the facility which is in place, first and foremost. The facility which is in place in Mavivia, already existing, which has been constructed by money from the European Union. A huge facility which is sitting there unutilized. That's number one. What are we not utilizing? Then number two, the issue of construction of an abattoir in the area and the land, where the land has been provided for that. And then obviously, you have talked about looking at Marikiti and the way the place is normally crowded, especially during market days. Honorable members, I wish you'd be able to visit Mavivia. It's not very far. If the committee does site visit, do go and visit it and see it's a huge facility where the World Bank, I think the European Union spent more than 30 million shillings in constructing a huge facility, putting hotel facilities there, putting all issues in place to facilitate it to be a marketplace. And the market had been moved there, only relocated back again to Machakos town for reasons which only the executive can be able to explain. So it will be important for the committee to handle this with the urgency required, because lives have suffered, businesses have suffered, and the people have gone through a lot of losses as a result of that relocation of the market. And I therefore order that we offer you this extension, but on what date? You have said which date is it? 1st of February 2022. Thank you very much. Mr. Clerk, proceed.
Order number 8, adjournment of the House for long recess.
Members, under this order number, we have one business which is going to be moved by the Honorable Alex Kamitu on behalf of the Majority Leader. Honorable Alex Kamitu.
Thank you very much, Honorable Speaker. I'm Alex Kamitu, MC Tala Ward and leader of minority in this House. Adjournment of the House for long recess. Honorable Speaker, that I aware that pursuant to Standing Order number 25 sub 1, the Assembly approved an Assembly calendar on 10th March 2021 and amended it on 26th May 2021 and further amended it on 30th November 2021, aware that the calendar provides for the sittings and recess for the House. Noting that the 5th sessions of this second Assembly began on 9th February 2021, aware that the crucial business has been transacted during this session, including considerations of the Machakos County Environment Management Bill 2020, the Machakos County Abattoir Bill 2020, the Machakos County ECD policy, among others. Aware that Standing Order number 25 sub 3 provides that on a day when the Assembly is scheduled to adjourn to a day other than the next normal sitting day in accordance with the Assembly calendar, the leader of the majority party or minority party or any other member of the House Business Committee shall move a motion of adjournment which shall be debated for not more than 3 hours, after which the Assembly shall adjourn without question put. Honorable Speaker, I wish to move the motion that pursuant to Standing Order number 25 sub 3, the House to adjourn for the long recess from Thursday 23rd December 2021 and resume its sitting on Tuesday 25th January 2022 as per the Assembly calendar. Honorable Speaker, I now call upon Honorable Moses Mita, the Majority Whip, to second the motion.
Thank you, Honorable Kamito. Honorable Moses.
Thank you, Honorable Speaker. I want to second the motion and take the opportunity also to give my input, Honorable Speaker, that it is important we take the recess. Honorable Speaker, as you have noted, we were supposed to go on recess on 8th of December, and today is 22nd of December. We have delayed due to backlog of work, which we have cleared. And Honorable Speaker will be away for only a week because we have a very important business ahead of us on SECEB. And Honorable Speaker, I'm aware that from 4th January 2022, we'll again go for public participation for about a week, and then we'll have another week to do reporting, and then the following week we'll be back. So, Honorable Speaker, in fact, it's not a recess. It's a work recess, because we'll only rest for 1 week. I want to also to take the opportunity to wish my colleagues Merry Christmas and Happy New Year. We take care and we observe COVID rules, Honorable Speaker. Thank you.
The Honorable Member has commented before I proposed the question, and because he was so passionate, I took it as part of the seconding. I now propose the question, Honorable Members, that this House discuss and approves that pursuant to Standing Order number 25 sub order 3, the House adjourns for the long recess from Thursday, the 23rd day of December in the year of our Lord 2021, and resume its sittings on Tuesday, the 25th day of January in the year of our Lord 2022, as per the Assembly calendar. Honorable Members, you may comment on the motion. Honorable Justice Katumo.
Thank you, Honorable Speaker. Honorable Justice Katumo, hear the voice. I want just to say that I really agree that it is a time that we take this break. It has been a long year. We have done a lot, and it reaches a time when we need to rest and be together with our residents and families. This might be the last long recess, and therefore it is good to go and reflect and to live well with our electorate so that we can see what they are saying. And I think it is actually, it will be a good moment for us to reflect and also think through what this long festive season, what Jesus Christ did for us. And if we have done a lot of sins, we need to really look at ourselves and make sure that as we jump to 2022, as we come back, we are refreshed for yet a new season that we are going, because I know next year will be a lot. I want also to take this opportunity to thank members in this house. We really did a lot, and it is always good for us to look back and then reflect, as I've said, that we need also to reconcile ourselves to the fact that as we do our business in this house, there are many challenges. We might come across one another, and it's good as we go out there and reflect on ourselves that we also forgive one another, we also pray for one another, and we wish each one of us well, so that as we come back, that we are ready from the same page. And therefore, I support this recess. Is long overdue, and I think we deserve it as members. Thank you, Honorable Speaker.
Thank you. Honorable Judas Ndawa.
Thank you, Mr. Speaker, sir. Again, I want to air my views on the motion before the House and say that I'm supporting the motion on adjournment 100%. Mr. Speaker, having said so, I want to say that Machakos County Assembly is the only committed assembly within the Republic of Kenya. Why am I saying so? All the 46 counties are at home for the last 2 weeks. The National Assembly were only called, summoned today to come and deliberate an issue. They went home. But because Machakos County members are very committed, we have remained, we have offered our time to continue serving our electorate. So, Mr. Speaker, I would like to thank my colleagues and the entire administration of Machakos County Assembly for being committed and being passionate to ensure that the most sensitive businesses are handled before we go home. So, Mr. Speaker, I want to support and request now, as we are in the final stages, we are winding up now. Mandate is also coming to an end. Mr. Speaker, I would request my honorable members, my colleagues here, together with the electorate outside, together with the executive, since January up to December, those are 12 months. Can we evaluate ourselves? What have I done to assist myself? What have I done to assist my family? What have I done to assist the electorate? What have I done for the county of the nation? Mr. Speaker, we may find that one is free and he has done nothing. And maybe somebody who is in jail, who has been convicted for a certain offense, that particular person is given a small task of crushing this kokoto and barracks, and at the end of the year, he or she is given at least 200 shillings to go home with. Other people are free here. They have not done anything. So it is better that particular person who was in jail and he has earned 200, you are free and you have not done something. So, Mr. Speaker, as we come to finalize the last part of our session, let us come here focused. Let us come here with good faith. And finally, Mr. Speaker, as honorable members, during our service, as we are trying to execute our mandate, maybe in case we went wrong somewhere, we want to take this opportunity to say we apologize. We don't want Jesus Christ to be born when we have issues. So in case we have wronged anyone, we are sorry and we are saying, please forgive us. Thank you very much, Mr. Speaker.
Honorable Judas. Honorable members, we've come to the end of this session. Personally, on behalf of the chair, Madam Speaker, I would like to thank you all for the contributions you've made during the past 1 year, during the fourth session of this assembly. We've come that far, as you have seen. We have achieved a lot in terms of house business. We've been able to enact laws. We've been able to pass motions. We've been able to handle statements. We've been able to handle petitions, which have been brought before this House, as per the mandate given to the House by the Constitution of this country. I would like to thank each one of you again for your active participation and for the collaboration and for the constructive criticism which has been going on in this House. What I've seen personally is objectivity in everything we have done, and I therefore would like to urge you all to continue with the same spirit, even as we come and open the new and the final session next year. You have achieved a lot. As a person, do not feel like you have not achieved a lot. First and foremost, just being able to go through the year and come to the end, we have a lot to thank God for as a house, and we have a lot to thank God for as a person. And therefore, I wish all of you the Merry Christmas and a prosperous New Year, full of God's blessings. Enjoy your holidays with your families. Rest, eat, make merry. It's time to do that. So that by the time we start again next year, we are all refreshed and recharged, ready for the long haul of what awaits the country and each one of us come next year. And I do believe the Lord is going to be with us. Thank you all so much, and say a big hello to all your families. With that, the House adjourned to resume on Tuesday, the 25th day of January 2022 at 10 a.m. Enjoy your holidays.